Dear brothers and sisters, warm greetings from Sri Balaji Vidyapith, popularly referred to as Sbv. I am delighted to meet you all once again through Channel One. I thank you for your continuous support in this endeavor. Cancer burden continues to grow globally, inflicting tremendous physical, emotional, and financial strain on individuals, families, communities at large, and the comprehensive health systems. It must be said, in all fairness, that several health systems in low and middle income countries are minimally prepared to manage the burden caused by the cancer, and a large number of cancer patients globally do not have access to timely quality diagnosis and treatment. In countries where health systems are robust, survival rate of several types of cancer are improving thanks to early detection, quality treatment, and personalized health care. It is quite unfortunate that cancer continues to be the second leading cause of death globally, accounting for an estimated 9.6 million deaths, or 1 in 6 deaths as for the statistics available in 2020. Lung, prostate, colorectal, stomach, and liver cancer are the most common types of cancer prevalent in men, while breast, colorectal, lung, cervical, and thyroid cancers are rampant in women. Cancer may appropriately be referred to as a large group of diseases that can have its origin in almost any organ or tissue of the body wherein abnormal cells grow uncontrollably and go beyond their usual boundaries and limits, culminating in the invasion of adjoining parts of the body. Alternatively, they can spread to other organs, a process known as metastasis. Pathologists in healthcare setup have a huge and dedicated role to play in the prompt and early detection of malignancies by restoring to the use of various available modalities such as cytology, histopathology, aided with immunohistochemistry and molecular pathology. This acquires special relevance in promulgating the targeted therapy of various cancers. Gender distribution of cancer reveals male predominance with 52.4% of cancers reported in males and 47.6% in females. The proportion of all cancer cases is higher in males than in females. Childhood cancers constitute 7.9% of all cancers. Gynecological cancers, including breast cancer, comprises over half of all cancers in females, whereas cancers of the head and neck region account for nearly 1/3 of the cancers among males. The highest proportion of cancer from all sides was reported in the 45 to 64 years age group, except for prostate cancer in males, which was higher in those over 65 years. Cancer in sites associated with tobacco use comprises 48.7% of cancers among males, and 16.5% among females. Use of tobacco is associated with cancer of the lung, esophagus, mouth, tongue, larynx, and urinary bladder. According to the National Cancer Registry Program Report 2020, cancer cases in India are likely to increase to 15.6 lakhs by the year 2025, a 12% increase from the current projection. 1 in 10 Indians are at risk of developing cancer during their lifetime, while 1 in 15 may die of the disease.
A good day to one and all. I am Dr. Bhavani. I am a pathology professor. I am here today to explain about the role of pathologists, how it was changing from the previous era to this modern pathology world in diagnosing the cancers, which helps in the cancer awareness. The first paradigm change in the role of screening pathologists took place during the second half of the 20th century with the introduction of novel technology, that is immunohistochemistry. The possibility to identify the specific proteins on normal as well as pathological cells first allowed us a more detailed understanding of specificity of expression by most pathologists, providing the several ways to the classification of neoplasm. For example, it helps in differentiating the in situ neoplastic component rather than the invasive, and also in specific cases which helps in diagnosing the specific histotypes rather than the others. The introduction of immunohistochemistry has made it possible for the pathologist to classify certain neoplasms, establishing more appropriate criteria for the correct diagnosis and establishment of correct treatment to the tumor, adding a new perspective to the application in the prognostic as well as in the predictive field of specific tumor. For example, there are certain tumors, many tumors are available. For example, we will see gastrointestinal stromal tumors which usually occurs in the GIT, especially in the duodenum, will be CD117 positive, are more responsive to the imatinib. In subsequent years, the development of targeted therapy first and immunotherapy then significantly increases the need to identify the specific targets on cytological or histological samples, which helps in stratifying the patient based on the possible response they could obtain from the specific drugs. Newer diagnostic methods such as liquid biopsy facilitate more of molecular and genetic identification of cancer signatures that gives a way or pave the way to identify the individualized therapy, which is specifically called as personalized therapy nowadays. The advent of personalized medicine has marked a significant change in the study of cancer mechanisms and their pathogenesis and approaches to the treating cancer. In context of these changes, pathology can play a fundamental role in both the clinical practice as well as in the research.
Surgical removal is performed to reduce the tumor burden. Chemotherapy uses medications that are toxic to cells to kill rapidly dividing cancer cells. It is the most typical treatment modality for many cancers, regardless of the clinical extent of diseases at presentation, including cancers of the liver, gallbladder, stomach, lung, and childhood cancers, and regardless of the organ site and clinical extent, most cancer patients were initiated on cancer-directed treatment within 8 to 30 days of diagnosis. Radiation therapy uses powerful focused beams of radiation inside or outside the body to kill cancer cells. Stem cells or bone marrow transplant repairs the diseased bone marrow by incorporating healthy stem cells. Stem cells are undifferentiated cells that can have a variety of functions. These transplants allow doctors to use higher doses of chemotherapy to treat cancer. Immunotherapy uses antibodies to help the body's immune system recognize cancer so it can fight it off. Hormone therapy removes or blocks hormones that fuel certain cancers to stop cancer cells from growing. Targeted drug therapy uses drugs to interfere with certain molecules that help cancer cells grow and survive. Multimodality treatment is a varied combination of surgery, chemotherapy, and radiation therapy. Government initiatives and policies. India is committed to achieving a 1/3 reduction in cancer-related deaths by 2030 as part of the Sustainable Development Goals. And it has made considerable progress. Government programs such as Ayushman Bharat, Swasthya Bharat, Swachh Bharat Abhiyan, and Pradhan Mantri Bharatiya Jana Aushadhi Pariyojana, and initiatives such as FSSAI's new leveling and display regulations and drug price control can encourage inter-sectoral, multi-sectoral actions. Other initiatives such as the National Health Policy, the National Tobacco Control Program, and the National Program for Prevention and Control of Cancers, Diabetes, Cardiovascular Diseases, and Stroke are also paving the way for progress. The National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke is being implemented under the National Health Mission for up to the district level activities. India has created the world's first database of genomic variants of oral cancer. We need to focus on 3 nodal aspects pertaining to cancer awareness, which include risk reduction, early detection, schedule, and policy-based solutions. Cancer detection and drugs need to be affordable so that whenever required, the treatment can be provided at the earliest in the early stages when the cancer is curable. Availability and affordability of cancer drugs will give impetus to treatment outcomes, bringing down the cost of treatment. I shall conclude by drawing your attention to a few important quotes. There is no medicine like hope, no incentives so great, and no tonic so powerful as expectation of something tomorrow. Hope is living with courage and confidence, not fear. Cancer is a journey, but you walk the road alone. Don't give up. Well, my dear viewers, a big thank you to all. You have been quite generous enough in patronizing the exclusive episodes on Channel One. I do sincerely believe that you would have enjoyed these unique episodes. To be precise, all the 35 episodes till date that have been featured on topics of contemporary interest in the realms of health sciences. These monthly episodes on Channel One from the desk of the Vice Chancellor, Sri Balaji Vidyapith, have been carefully researched prior to the presentations. On a personal note, I would like to share that it has been a tremendous experience for me, and in this regard, I have to state emphatically that my able production team has done themselves proud. God bless you. Jai Hind.